So calcium is an electrolyte. It has two positive charges on it. And it is also really important in the normal functioning of your nervous system. Your neurons take in calcium when they're releasing neurotransmitters. And it is also really important in the functioning of your muscular system. So your calcium binding to the regulatory molecules in your muscles causes those muscle fibers to move and to cause contraction. And so we need some mechanism for regulating that. And generally, the problem is not too much calcium, but it's not enough calcium. So we're talking about hypocalcemia in the blood. So this is the compartment that has the most amount of calcium. Hypo means low levels of calcium. We have the ability to detect that calcium in our bodies and then respond to it. So the control center is that releases it is the parathyroid gland. So this is under hormonal control. The parathyroid gland is these tiny little pieces of glandular tissue behind your thyroid. So you have your thyroid, it is big, it is in the middle, and then behind it on the posterior surface is the parathyroid gland. So it can release parathyroid hormone, or PTH. And this parathyroid hormone can cause different things to occur, primarily if you're not taking in calcium. So like, for example, if you're older and you're not drinking milk and you're not eating cheese and you're not taking calcium substances, or like taking calcium as a mineral that you have in your cabinet, what happens is that we can take calcium out of our bones. So we can increase the release of calcium from your bones. And this actually can lead to, in older people, it can lead to osteoporosis, which is where there's not enough calcium in the bones. So the bones become brittle and they become weak, and they're like full of holes. And so you could break your bone and then fall down, and then that could be like breaking the hip would be a very bad outcome of having osteoporosis. So if you're older, and specifically if you're like if you're white, if you're an older female, if you are taking hormone replacement therapy, HRT, you're going to have more of a problem with this. This also causes the reabsorption of calcium by the kidneys. So when that filtrate is modified, there's not going to be a lot of calcium in the urine, because we're going to have reabsorption of the calcium that is lost when the filtrate was formed. And then one of the things that we also do is we activate vitamin D. So the kidney activates vitamin D production. One of the things about vitamin D is it is necessary for absorption of calcium from your food. So if we increase vitamin D, we increase calcium absorption from the small intestine. So that is really important, and that's generally why, like in milk, they have supplemented the milk. They put vitamin D in it because you need that vitamin D to be present in order to absorb. In the wintertime, that can become a problem. And that can also, in children, lead to what is called rickets, where they don't have enough vitamin D. And so the bones do not form properly and it causes a bowing of the bones in children. Okay, so this is how calcium is regulated in blood. So this parathyroid is going to eventually cause the calcium levels to increase. That's the negative feedback. And so then the parathyroid gland stops releasing PTH in response to elevated levels of calcium. So it keeps it around a homeostatic balance.